This week's clinical reflection is supposed to be based off of type 2 diabetes. I believe actually like 95% of the population that have diabetes are type 2, that only like 5% of them are type 1. The differences between type 2 and type 1 is that type 2 is preventable by lifestyle changes, whereas type 1 is something that is hereditary. You can't really like do anything to change that you can't get like type 1 diabetes. I guess the treatment plan for type 2 diabetes is that you need to like do your blood glucose check levels right before meals before we can give you like insulin so then you don't like have hypoglycemia or hyperglycemia, either one of those. Another thing is that well, good thing to do is kind of like educate the patients about diets, like diabetes diets, to how to manage their diabetes without having to get insulin. So then it's easier instead, so it's less abrasive approach. Also want to make sure that we monitor the patients for having hyper or hypoglycemia, because either one of those is not good because we want to stay in a kind of stable, balanced in our system. Got what it was. It was homeostasis. That's what it was. So let's see. I think well, kind of reflecting back on it, when I first started like doing giving diabetes care is like my first time was during this whole program because I was not really involved into it too much. So I didn't know the process. So this was actually reflecting back on it, I was like kind of a new experience for me having to take care of patients that needed diabetes treatment. So I guess I will go ahead and do my clinical judgment model. Let's see, we'll base it off of like what was diabetes this week. So let's see. The situation, I was trying to prepare to administer like insulin for a diabetic patient. And then on my analyzing cue is that I would go over, check the patient's blood glucose levels, and then like after I get their blood glucose levels reading, as I would check their sliding scale, see how many units they needed of insulin. And like obviously right before like normally it was typically like breakfast, but any sort of meal. And then I would assess for any signs of like either if they were like hypoglycemic after they've taken their insulin. Um, the priority of my hypothesis is was to maintain like a safe like glucose levels for the patients while like preventing them to go hypoglycemic, um because that could be bad as well. And another one is those generating solutions. I verified the insulin dose performed like all medications, confirmed with the patients to make sure that they it was like, and with my instructor that or you or the preceptor, I guess I would say, if it was like the right dosage, just so then it was to be safe. And then I evaluated the outcome, and typically I've never had any issues with any of the patients going hypoglycemic or like yeah, having any of those symptoms. But yeah, I would always keep an eye out or monitor them afterwards, like maybe within like 30 minutes. So yeah, that is the end of my reflection.